Good evening, everybody. My name is Ryan Keha, and thank you for coming to Parent Talk tonight. This is a really exciting session that we've got. This is our final one for the season, our Parent Talk season, and so I really appreciate everybody joining in tonight. I am the Family Services Manager at Thread, and I've got a bunch of great people here to introduce tonight. So as our presenters for Childcare is Open, this is an awesome opportunity to just talk about the ways that the childcare sector has shifted during COVID-19 to keep children and families safe. As a lot of us know, as childcare providers and as family members, the childcare providers have been on the front lines, as they always are, but it was just extremely highlighted during the COVID-19 pandemic and continuing today as we continue to take our kids to childcare and lean on them for processing and support in every way. So I'd love to introduce Wendy Howard, who is a early childhood specialist at Thread. She's our bilingual early childhood specialist at Thread. We have Christy Davis, who is the Director of Childcare Assistance located in our Thread office in Fairbanks. We've got Christina Eubanks Ohana with us, who is the Director at Hillcrest Children's Center, and Stacey Collier, who is the Community Care Licensing Specialist #3 with the Child Care Programs Office. So thank you everyone for being with us tonight, and I'm looking forward to hearing more about how you and your teams have shifted during COVID-19. So I'm just going to get my screen set up here to share. Okay, so as a family member, as a parent, a lot of times we interact with families right whenever they're looking for childcare. So Thread is Alaska's childcare resource and referral network, and we help family members find licensed childcare through our resource and referrals, through our online tools, or through the phone. So Thread engages with childcare providers, with family members, and communities all across the state. So you would engage with us as family members through our childcare referrals, some tools and resources, and parenting information like tonight, like Parent Talk. And early educators engage with us through training, technical assistance on site, and also financial support. And then we engage with communities through consultation, different presentations, and then presenting research and data to them. So we have two different ways that you can engage with us through resource and referral, as I mentioned before, and that's through our online search tool on our website. And so this is a great one-stop shop if you're just looking for quick referrals that you just need a list. You can go onto our website, www.threadalaska.org, under our families portion and look for the childcare search option. It has really great information where you can enter your address that you're looking for care around, which could be around your work or around your house, or maybe it's a grandparent's house. And then some of the specifics about your children, how old they are, maybe the school that they go to, the type of care you might be looking for, and it'll pull up a whole list of childcare facilities, licensed childcare facilities within the area. You're able to print that list off, take it, call the providers, and hopefully get your kids enrolled in the care that fits you. If you'd like a more personalized approach, you're more than welcome to call our 1-800 number, 800-278-3723, where you will be connected to one of our early childhood specialists like Wendy Howard. And so one of the wonderful things that they do is they of course welcome you to Thread, and they ask you specific questions about what you're looking for, just like you would do on the online search tool. Name and information, a little bit about your children, their ages, and then similar to the online tool, they'll pull up a list of referrals, and then also talk to you just about how to look for childcare, right? Like sometimes we don't know the types of questions to ask the provider until we've done it before. And if you're new to the childcare world and looking for childcare, they're really helpful in helping you find the right questions to ask your providers. So they're also really helpful in helping find resources as well. Sometimes there's other things that we might need help with, whether it's additional supports with social emotional development or child development supports, and our early childhood specialists are really trained in supporting families and finding resources with that. We also have translation services available. So if English isn't your first language, or you have a friend or family that English isn't their first language, we do use a language line that connects us with interpreters. caregivers. And we also have the gift of having Wendy, who is our bilingual early childhood specialist who speaks Spanish. And so we have a wealth of resources to connect to help you find childcare. So before I move on, Wendy, do you have anything you'd like to share about a parent's experience with an early childhood specialist?
Well, I have to say that it's nice to talk to any families here. Our services is free and confidential. We want to make sure that you're looking for quality childcare, so we here to support and walk you through that process. We have great tools to share with you. We have some indicators what to look for in a childcare setting. So definitely, talking to one of us here. I am located in Anchorage, so we're here Monday through Fridays, usually 9 a.m. to 5 p.m.
Great, thank you. And Winnie brings up a good point. Our state, our Thread resources and everything is available statewide. So we have offices in Anchorage, in Fairbanks, and in Juneau as physical offices, but all of our services are statewide. So no matter the community you live in Alaska, we'll be able to connect you with licensed childcare. So a lot of times we partner with other agencies that support families as well with other resources. So if you've never heard of Alaska 211, Alaska 211 is a one-stop shop for resources all across the state. It's a wonderful place where you can search and find exactly what you're looking for, and they are constantly updating it, which is so wonderful. We connect with them all the time. We refer families there all the time for additional resources, and so I highly recommend checking out if you need any type of resources at all. Another resource that we connect families with a lot is Help Me Grow Alaska, and this agency is dedicated to supporting families with child development and doing the ages and stages questionnaire and connecting the families to specific referrals or with specific referrals for like medical diagnoses or any type of support, social emotional support that they might need. And so this resource is really helpful and really encouraging for families to connect with as well. So I'm really excited to introduce our next speaker. Her name is Christy Davis, and she's part of our Thread team up in our Fairbanks office as the Director of Child Care Assistance. So Christy, thank you so much for being with us tonight.
Thanks for having me. Just a little bit about our program. We cover both the interior and southeast. So when you look at this map, everything in yellow and in purple, we do child care assistance subsidy for those areas. Our office was used to doing things by phone because of having the southeast office. So when COVID hit, we just continued doing that. And we've been doing everything by phone, our interviews and talking with families about their needs. If you go to the next slide, in Alaska, we do have a program called Alaska In. We don't handle that in our office directly, but there is an application process and we can make sure you have that information. That's to help families that need more assistance with a child that has social, emotional challenges. They're on an IEP, any physical disabilities, and the state office handles the application process, and Thread helps with the evaluations that are done with that program. We do take care of Pass 1, Pass 2, and Pass 3. Pass 1 is families that are on work services. They're getting temporary assistance through the DPA. I actually authorize those. The caseworkers in the DPA office request them. So I complete that process and make sure that the providers get their authorizations. Pass 2 is anyone who's been on temporary assistance, is transitioning off. The nice thing about being Pass 2 is if we ever went to a waitlist situation, you would have priority over someone who just walked into our office and applied for Pass 3 childcare. So that is the benefit. It gives them a year that they have that priority. Pass 3, anyone who comes in needs childcare assistance can qualify for Pass 3. That meets the minimum qualifications. There's a income, word just escaped me, sitting outside enjoying the sun, I guess. So the income level for each family size is what determines your primary qualification, but you also have to be in an eligible activity. Eligible activity can be working or going to school. And if there's more than one parent, they both have to be in an eligible activity to get past 2 or 3 child care assistance. And go on to the next slide. So the family income and contribution schedule is what I was referring to. I think we have a sample of it. Yep. And you go down the column for the size of your family. All the way at the bottom of that, there's a maximum income that you can make, and that is gross income by family size. And that's based on the state median income, 85% of the state median income. And so your income is calculated, and then we find out what your copay would be. Your copay is your portion of the state rate that the state is going to pay. So your copay comes off of that, then the state pays the difference. If the provider charges more than the state rate, you are responsible for that amount as well. The child care assistance application it's a lengthy process. It's a lengthy application. The more information you put on this application, the quicker your process can be. It also starts with several pages that tell you the rights and responsibilities of the program, as well as what documentation we need in order to be able to qualify you. Pay stubs, school schedules and income from going to school, children's birth certificates, your IDs, those types of things are all listed on those first several pages of the application. The back page is really important. If it's not signed, we're going to send it back to you. So make sure you sign your application before you send it in. We want to be able to process your application timely and get authorizations so that your kids can start childcare as soon as you need them to. I think that pretty much covers our process. Like I said, we are doing everything by phone. We are very used to doing that. And you can come into our office and drop off paperwork. You can go to the Juneau Thread office and they will fax things to us if you don't have access to a fax machine, and we'll get you taken care of. Thanks.
Excellent. Thank you so much, Christy. I know that Christy and her team, as well as the other child care assistance offices throughout our state, from that map that Christy shared, has been a huge piece during the COVID-19 pandemic and getting children and family back into child care. Christy and her team have been really flexible and listening to a lot of the stories that families have been sharing about going back to work and restarting care. And thankfully, Christy and her team have been just really great listeners and helping people make the right choices. And of course, using the child care assistance funds to be able to help people to get back as long as they qualify. So thank you, Christy, to you and your team. Is there anything that you guys learned specifically during the pandemic from some feedback from families, or heard any kind of common themes that might be helpful for families to kind of consider when applying for child care assistance and returning to care?
A lot of families have expressed that there's a need for additional childcare, and it's more the younger ages, the infants and toddlers. I know providers are trying to increase their limits as far as the number of children capacity, but as things open up more, maybe those spaces will open. So the best thing is just don't give up hope, because I know there's got to be a provider out there and we've got the funds to be able to assist.
Awesome. Thank you so much for sharing, Christy. I know that's very helpful information. Next, I'd love to introduce Christina Eubanks-Ohana, who is the director at the Hillcrest Children's Center, located here in Anchorage. And I'm very thankful for Christina and her team, because they have been great advocates and using their facility to help advocate for safe quality care. And so I'm excited to hear about what her and her team did, how they kind of handled the pandemic and increased their health and safety plans to make sure everybody was safe. So thank you so much, Christina, for being here.
Thank you. Sorry about that. Hopefully, I'm trying to move back to the car. I just arrived in Homer. So I'm Christina Eubanks. I run Hillcrest Children's Center, a nonprofit child development center in Anchorage. Like I said, I've been doing it for 14 years and have been in the field for several decades more than that. And when the COVID pandemic hit, at the beginning, because we are a nonprofit and our parents on the board, we do a lot of decision making together as a group. And so we utilize Zoom for the first time to hold meetings with the families and discuss what we knew and the plans to going forward. And Hillcrest never closed at the beginning. What we asked is families that we would move down to essential personnel only. And so we asked families if they were at all able to continue to work, they're working from home with their children, that they would keep the children at home. And then we served families who didn't have jobs that would allow them to do that, or had situations where that just wasn't an option in their family structure. So we had some families with some children with special needs that they couldn't be in meetings and have their children not directly supervised. And so we did that at the beginning, and that dropped our enrollment to less than 1/3 of the children. And at some point in time in there, we were we were serving less than 10 kids a day versus over 60 that we were doing pre-pandemic. And we worked with the staff to make sure that they transition out, because finding good, reliable staffing is so hard. We worked with them to, we continued paying them until it was, they were able to qualify for unemployment. And then we worked with them to figure out which staff were going to stay employed and which staff were going to go on unemployment as we moved through and learned more. And then we were just doing continual monthly meetings with families discussing risk, and also what our mitigation plans were. And so we worked on keeping kids together. And at first we did family groupings. So because we had a lot of sibling pairs that were in there, so we were grouping kids by sibling pairs, which drastically lowered the ratio because you have to go off the youngest child in that group. And so it made our group sizes of 8. And so we did that at the beginning, and increased cleaning. We closed down one of the rooms so that we had a larger staff room, so that staff were able to do hand washing and cleaning, and in keeping themselves separate from the kids and during their breaks. And then as things moved on and families during the summer felt a little more comfortable, we increased and had few more children showing up. We moved to going back and kind of switched around the group sizes, but still kept groups isolated from each other during the day. And then one of the things that we were doing, temperature checks, increased cleaning, so sanitizing and disinfecting of services several times a day. We also put in a air filtration system, and so we got a grant for that. So now the air is ran through filtration systems 11 times an hour. That's UV and HEPA filtered, and then we do full air exchange, fresh air exchange from outside 4 times an hour. And so as we, continue doing that, more and more families felt comfortable coming back. And so we brought back staff to match that. And that's kind of been one of the biggest struggles, is making sure we had employees coming back, because at the beginning of the pandemic, some of our staff had just chosen that this was a time that they were going to switch what they were doing with their lives. And so some people chose to stay home, some people chose to retire. And so there was also discussions with them. And so we knew we were losing quite a few of our senior staff. And that also has made it harder as we've been enrolling back up. More of the families have come back. So all our families have come back. And then we've enrolled a few more new families, and is just, getting the new staff trained in, finding the new lead teachers, that we needed to replace. And so a lot of the time in doing this, and it has been with the families, just a discussion about risk management, our risk management, and then what they're comfortable with. And so one of the things that we've done is that we've required during the process of when COVID was hitting, and then the fall, last fall, is that we were having the staff do weekly COVID testing. And so while we did have a number of the staff come down with COVID, they were all community spread cases or in their home, and we caught it in the time that there was no spread within the center. And so it did lead to some closures during, we had a couple of weeks that we were closed for each of those through October and November. But then that went through, and we didn't have any more exposures among staff. And then as the vaccines were available in the spring, then we required all staff and any new hires have to be vaccinated for employment. And then as we've gone through that, and then all the staff, then that has brought us back to having all the families return. And now we are just full, but we are running at a higher staffing to still manage the safety. And we still have closed down that infant room that we turned into a staff room. So it's still a balancing of finances to maintain all those. The last thing that we did was we had required all staff to mask. In this last month during the board meeting, the parents agreed upon that our infant and toddler teachers would no longer need to mask during the day because they are vaccinated. And we've been talking a lot through this past year about the importance of mirror neurons and brain development. And we tried quite a few different clear masks so that babies could see our faces, but that just did not really work out as well with the condensation. And so they were given the option not to mask, but because our 3 and ups are still masking inside, those teachers are masking inside as well to model proper safety protocols. But we are outside, no one has to. So that is the last big thing. And then we are sending out a survey this summer with families about their thoughts on immunization for their children when those start becoming available this fall, so that we just have confidential information that will be shared as a group with de-identified, so families, we can make decisions again together about what that's going to look like this fall. Did I cover everything?
That's amazing, Christina. Thank you so much for all of that information. And I just have to say, you're such a great leader, and that key of like listening and silent, right? Like they have the same letters, and for you as a center director, and to listen to the parents and listen to who make up your board too as parents, I think that that's a huge skill, especially during a time of chaos, right? Like everybody was going through this pandemic, and so to take time to listen about what are the needs and how can we meet them is huge. So thank you to you and your team for being so flexible and continuing to provide high quality care. Do you often still have parents calling to ask about your protocols, or do they ever share like concerns about returning to care or ask questions about that?
Yes, it's really because of the fact that we took a stance that our employees were vaccinated. We ended up getting some families that have moved centers who didn't have that.
Yeah.
And so I think that is, and that's just what worked for us. And it was, just something that and I think, given we talked through, and I talked through with staff who had some vaccine hesitancy, and we didn't push. It was like, let's talk through it. And I think when they felt that they did, it wasn't, you had to do it now, let's talk about it. And it wasn't pressured, then that took up some of the stress for them.
Right.
And then they watched so many of us who had already gone before to get it. So they're like, okay, this is,
you know, they just felt comfortable for that, because they also saw those of us get sick, and some of our families lost family members to COVID.
Yeah.
And so they, you know, there was also the real risk of that. And so it was just the decision that we made. But yeah, so usually, and it is something that we just put, it's like the first thing on our website now, just so families would know when they're looking, like, you know, this is our stance and this is what we're doing. And we took that stance, and another stance we didn't is it was recommended through the CDC that you would greet children at the door and be taking kids from the door and bring into the classroom. And that is not in the culture of our center. We tried that at the very beginning. We were following that. And we were honest. We came back 2 weeks later with all the families, and we said, okay, for those of you who are infants, you'll know that we never took your child at the door, because that just did not sit well with us. It didn't sit well with you guys. So you guys were always in the building. And, you know, the toddler and preschool parents were like, we chose to be at Hillcrest because of the community feel, because, you know, that was an extended family. And so it was never something that that was not something we've done. We still require families and guests to mask in the building, regardless of their vaccination status, because it just makes it easier for the staff to manage. But we always allowed them to come into the classrooms, because that just didn't work for our center.
Yeah. It's amazing, Christina. Thank you so much for sharing your story. And I know that just hearing your experience, hearing the way that you've engaged with families, like all the parents who are listening to this and watching, if anything, are going to be encouraged to ask more questions. And I think that's a big piece of all of this, right? Is every center and every family is different. And so asking questions what for the needs of you and your family is extremely pivotal, and not only finding care in general, but also finding childcare during a pandemic, right? And as vaccinations continue to roll out and more people are vaccinated, hopefully the risk becomes lower and we're able to get back to absolutely normal care here. So thank you so much for being here tonight and for sharing your story, and just really being honest with you and with your families and the people who you're caring for most. So thank you so much for sharing, Christina.
Thank you.
All right, the next person I'd love to introduce is Stacey Collier, who is the Community Care Licensing Specialist 3 with the Child Care Programs Office. I'm so very thankful for Stacey. We've worked together for years, and I just love her honesty and support, constant support of child care providers and partners all across the state. So thank you for being here tonight, Stacey.
Thank you for having me. So hi, my name is Stacey Collier. I am the Child Care Licensing Program Manager for the state of Alaska. I work for the Child Care Program Office, which is housed within the Division of Public Assistance, Department of Health and Social Services. So who is licensing and what do we do? Child care licensing promotes quality care by ensuring licensed child care facilities meet regulatory, health and safety standards and program requirements. Child care licensing monitors, regulates, and licenses child care facilities across the state. We set standards to reduce predictable risk and improve the quality of care to children in Alaska. We conduct announced and unannounced inspections to ensure the health, safety, and welfare of children in care. Also to determine compliance with licensing statutes and regulations, and to determine if enforcement actions will be issued for violations of regulations or areas of repeated noncompliance. Child care licensing provides technical assistance, orientation, monitoring, and regulatory-based training to child care providers statewide. We issue child care licenses to homes, group homes, and centers in regulatory compliance, and we investigate reports of concerns. So the parent's role in quality child care is extremely important. It's a key to quality care. A key to quality care is an informed parent. Choosing care for your child is a significant decision. When you entrust the care of your child to another person, you're making an important decision, not only for your child, but also for your own peace of mind. It's ultimately a parent's decision to choose a facility which meets their family's needs and standards. A lot of other things come into consideration when choosing the right child care facility for your child. What are the hours? How much does it cost? Is there an educational component? Is there a set schedule? What types of reports are provided daily regarding my child's care? Does the child care provide meals, snacks, supplies? Do they offer field trips? Do they allow visitors throughout the day? There's lots of things to consider, and we know this. So for licensing, we try to help in any way we can. Licensing specialists conduct inspections at least twice a year. So we're in the facility ensuring that facilities meet those requirements. However, we're not in the facility every day. Parents are usually in the facility multiple times a day at drop-off and pickup. So it's important for families to know the licensing requirements and to pay attention during their visits. What do you see when you pick up and drop off your child? Is the environment safe? Is your caregiver knowledgeable, nurturing, and communicating with you about your child's daily care and needs? How many children are present? Are there enough caregivers? Are activities appropriate? Watch how your child responds to the program and interacts with their caregiver. Listen to what your child says and pay attention to any changes in their behavior. Parents often ask us, what do I do if I have questions or concerns about the care my child is receiving? So we first recommend that you speak directly to your caregiver or the facility's administrator if you have any concerns, if you observe any health or safety issues, or you have suggestions for improvement to the facility's program. Most times, issues can be easily addressed and resolved when communicated. However, if you feel that your concerns are not resolved, or you believe children may be in imminent danger, or you feel licensing standards have been violated, we recommend that you contact your local child care licensing to discuss your concerns. So during COVID-19, it had a huge impact on licensed child care providers. During the COVID-19 pandemic, your child care needs may have changed, or your facility's ability to provide the care you needed may have changed. There was no state mandate for child care facilities to close or to stay open during COVID-19 pandemic. Child care facilities had to make their own decisions on what was best for their business, their staff, and the children in care. Although some licensed child care facilities never closed, the majority of the licensed child care facilities statewide were temporarily closed at one time or another during the last year due to COVID-19. Some facilities closed temporarily for a few days to clean and sanitize after an exposure or positive COVID case was revealed. Some remained closed for months until it was safe for their facility and for their community for them to reopen. Other facilities closed for longer periods of time, and some are still closed due to the location of their facility being located in a school or a church or other building where additional precautions prevent them from reopening. Unfortunately, during the pandemic, we lost some licensed child care facilities. They made a decision to permanently close. And then the other part of that, we had some good news. We were able to successfully license brand new child care facilities during the COVID pandemic. During the pandemic, child care facilities implemented new policies and procedures and created mitigation plans to keep children and families and their caregivers healthy and safe while in care, and to be able to resume care. CDC recommendations were followed, and facilities required masks and other PPE for staff, social distancing, and hand sanitizing. A lot of child care facilities had to reduce their capacity and child caregiver ratios to ensure appropriate social distancing and spacing of children in care. Child care facilities worked really hard during the pandemic, and we really appreciate all of their dedication in keeping children safe while in care, and appreciate all of the support that they provided to parents to allow them the ability to continue or to return to work during the COVID pandemic. Without child care facilities, we wouldn't have made it through this pandemic, and we know that. We all know that. Throughout the COVID-19 pandemic, child care licensing provided resources and technical assistance to help child care facilities with development of health and safety practices, policies, and mitigation plans, provided resources and technical assistance to help facilities find and obtain PPE and cleaning supplies. Also, during the COVID-19 pandemic, licensing had to halt our on-site inspections to keep our own staff safe. So we had to create and implement virtual inspections and other ways to measure child care compliance. Currently, we're still conducting those virtual inspections where travel is required. However, we've resumed on-site inspections throughout the state for facilities that are accessible by car. We have child care licensing offices in Anchorage. The municipality of Anchorage child care licensing office is also located in Anchorage. We have child care program office licensing offices in Fairbanks and Juneau as well. So while our licensing specialists are on site, they're still following the facility's mitigation plans. They're wearing masks or additional PPE if required and as applicable. They're maintaining 6 feet distance. During the time that they did inspections, they used their own pins. They had providers sign with their own pins. They tried to make sure that they respected those child care facilities mitigation plans and didn't make any additional concerns, because the child care providers were working really hard to keep children and their staff safe. So we communicated as much as possible of what we were going to be doing and how we were going to be doing it so that we could ensure the safety of children as well. Throughout the pandemic, the CARES Act and with some additional state funding, CCPO was able to provide additional financial support to child care facilities statewide. This funding helped some facilities remain open. It helped others to reopen. It helped some facilities pay and retain their caregivers. Others used the additional funding to purchase PPE, cleaning and sanitation supplies, and to implement other screening measures for children, parents, and their staff. As Rianne mentioned, childcare is open. The majority of our licensed childcare facilities statewide are back up and running and enrolling children in care. Like I said before, some facilities never closed. They stayed open during this entire time. And we, like I said, we really, really appreciate that. You can rest assured that licensed childcare facilities are monitored by childcare licensing to ensure the health and safety requirements are being met and your children will be safe while in care. Thank you for your time.
Thank you so much for sharing all of that, Stacey. Wow, such a great overview of all the things that licensing has done to support all the providers, how providers have continued to support children and families all throughout this pandemic. Thank you so much for all that. And I hope even as parents that gives some more assurance of, wow, yeah, not only did Christina share some amazing stuff with how her facility is doing health, have increased their health and safety precautions within their facility, but even hearing from Stacey about all the ways that licensing has seen it and supported it and encouraged it is really helpful. And so, yes, childcare is open. We are so thankful for all the ways that providers have supported families all throughout this time, because we have a lot of essential workers who still needed childcare. Our childcare providers are essential workers, and for that we are so very grateful. I am so appreciative to Wendy and Christy and Christina and Stacey for all being here tonight to share your stories of not only how you all adapted through COVID-19, but that you're here to support other families across Alaska through attending childcare, in opening up your facility to enrollment, how we can support you finding childcare. So there's lots of ways to connect with us. I have the information here for Thread on how to get in touch with us to connect for childcare referrals, if you're looking for referrals. And then I can also connect you to our other presenters tonight if you're interested in asking more questions. As I said before, this is our final parent talk for the season. We're so excited to plan and get ready for our next season. We will be holding it virtually as well. And this helps us be able to reach all across the state to talk about wonderful topics, engage more with the people of our state, the parents of our state, and support one another more. So please feel free to reach out if you have more questions. Feel free to visit our website, threadalaska.org, for our childcare search tool and any more resources. So thank you so much for being here, and take care and have a wonderful summer.